Chairman, item 11 on the agenda, Sheila Davies and Kelly Netton are here to present the 2019 Community Health Assessment.
Good morning, ladies, and thank you, Sheila, for agreeing to do this.
Absolutely. So every 4 years in North Carolina, public health departments are required to participate and conduct a community health needs assessment. And actually every 3 years, it's an IRS requirement for nonprofit hospitals to conduct a community health needs assessment. So we partnered a number of years ago with the Outer Banks Hospital, and we now do our community health needs assessment on a 3-year cycle. That way we meet both of the requirements. And the premise behind this and these requirements is to make sure that you have agencies looking at what are the gaps in your communities that may need addressing and may need community action. And we facilitate this work through the Healthy Carolinians of the Outer Banks, which is a partnership of engaged agencies and stakeholders that look at these reports and then create focus groups work groups to address any gaps in what's discovered in these health assessments. So today we're going to present the information that's been extracted through the Community Health Needs Assessment and also share with you where we're going in the work that we're going to be focused on over the next 3 years. Introduce you specifically, you met Kelly before, but Kelly Netton, she's our Public Information Officer and Communications Specialist with the Division of Health and Human Services, and she is really the backbone for us in getting this monumental task done as far as keeping us on track, working with the public, working with the community, the partnership, and then putting all this together, not just in this format, which is the big book of data, but in what's a much more friendly, easy to understand format. So she does phenomenal work for us, and she's actually going to walk us through this year's assessment.
Welcome, Kelly.
Good morning. Thank you for having me. Okay, make sure my slide advancer is on. Okay, so I'm just going to run you briefly through some of the pages in the book that you've received. The first slide, it talks a little bit about the methodology. You won't find that in the manual, but I want to make sure you have a good understanding of kind of what goes into this assessment. And we have primary data that we pull from, and that is what we hear from our residents. We do focus groups and community surveys. Secondary data we pull from all kinds of different sources. It could be North Carolina State Center for Health Statistics, CDC. And then once we get that information pulled, we move into the prioritization process. And so from there, we look at a watch list of items, and then we determine which ones we want to look at more closely. And then we move into the action and the evaluation phase. So we come up with action plans, we submit them to the state, we let them know what our health priorities are going to be. I also wanted to just make note that this is a regional effort. We participated in this for the first time ever. We are one of 33 counties that actually did the exact same assessment across the board. So what's really unique is now we can look at numbers across Eastern North Carolina and see kind of how we compare. So Dare County, a great place to drop your anchor. That is, we are on page 6 in your books. So what we have found here, and this was from our survey, that Dare County, 52% agree Dare County is a good place to grow old. 72% agree Dare County is a great place to raise children. 50% agree Dare County has good health care. 82% agree that Dare County is a safe place to live. 57% agree that Dare County has plenty of help for those during times of need. And 17% agree that there's plenty of economic opportunity in Dare County. So a little bit on the demographics overall, we have a population of around 36,000. We're about 50% male-female. We are, if you look under the average age section there, we are a little bit older when compared to the state of North Carolina, and that can be explained by the individuals that move here for retirement. Let's see, we are a little more educated when compared to the region and compared to Eastern North Carolina. So this is actually on page 8. So this is the watch list. So what we did is we looked at the data, we looked at all the indicators across the board, and then these were the priorities that the partnership ranked. So number 1 would be the most pressing issue, and number 10 would be the least pressing issue. We vote on several different elements, and then we average them out. So based on this watch list, the Healthy Carolinians of the Outer Banks decided that we really needed to focus on mental health, substance abuse, and transportation. Another element that we look at with the assessment are causes of death. And on this chart, you'll see the rate from the last assessment we did and the rate from this assessment. So far, we've seen decreases in heart disease, chronic lower respiratory disease, and pneumonia and influenza. Mental health. We have seen an 85% increase since the last assessment in death by suicide. In North Carolina, it is the 11th leading cause of death, and it's the 8th leading cause of death in Dare County. We have 1 mental health provider for every 640 residents, and when that's compared to the North Carolina ratio, North Carolina has 490. Poor mental health reports, we had 11.3% reported mental distress. And then here at the bottom, 19.2% of community survey participants reported poor mental health that kept them from normal activities in the last 30 days. So a little bit about substance abuse. So some health behavior data that we pulled, we found that 18.2% reported drinking excessively, 16.5% reported smoking. We have a liquor store density of 28 stores per 100,000. Community survey respondents in substance abuse, we had 32.4% respond that they had engaged in excessive drinking 1 or more times in the past 30 days. And another factor that's not noted on the presentation, but survey respondents expressed concerns with shortage of alcohol and drug counselors to help with treatment. Another thing that we heard a lot in the focus groups is people didn't know how to get treatment. So a little bit about what we found with transportation. 3.4% of households have no car. 2% of households have no car and a low access to grocery stores. We obviously have some geographical barriers when it comes to transportation in Dare County, and that is noted as well. Let's see, 1.6% report walking to work, 79.8% report driving alone to work, and that's kind of right there in the middle between the United States and North Carolina data. Access to health services. In the community health rankings that's done nationally, we ranked, out of North Carolina, we ranked 31 out of 100 for clinical care rankings. We have an estimated at 87.1% with health insurance, which has increased over time, but we're still not meeting the mark that, that they have requested. So mental health providers, residents to providers ratio, so this includes mental health, and doctors and dentists as well. So we've already been over the mental health number, but the primary care, we have 1,700 to 1, whereas in North Carolina, we have 1,420 to 1. Non-physician primary care, 1,284 to 1 in Dare County, 975 in North Carolina. And then dentists, 1,560 patients to 1 dentist. In North Carolina, 1,830 there. So older adults, just because we are a little bit older in Dare County, we do like to make sure we're paying attention to this as well. So it's something that we always report on. We have seen some numbers move in a positive direction with older adults. So 31.8% of our population is 45 to 64 years of age. 20% is 65 and older. And as you see, compared to North Carolina and the United States, we have about 5% more there. Older adults at risk, we have 26% that are 65 and older living alone, 4.2 65 and older living in poverty, 5% 65 and older that have low access to grocery stores, which kind of goes back to the transportation piece. And you'll find as you look throughout this book, a lot of this data kind of crosses over because it's all interconnected. Let's see. Cancer. So the good news with cancer is that our rate is lower when compared as across all cancers with North Carolina and the United States. So where we have room for improvement compared to our peers, oral cavity and pharynx cancer, we are a little bit higher than North Carolina and the United States. Same with pancreatic cancer, we're in between North Carolina and US there. Ovarian cancer, we are higher than both North Carolina and the United States. So moving on to prevention and safety. Let's see, we do have, an issue with drug overdoses, deaths in Dare County, unintentional poisonings, we have 19.4 deaths per 100,000, and that rate is higher than both North Carolina and the rates of the United States. There is lack of knowledge, as I've mentioned earlier, about addiction and prevention services, so that can lead to difficulty when individuals go to get help. 17.2% of Dare County households report at least one of the 4 housing problems: overcrowding, high housing costs, lack of kitchen or lack of plumbing facilities. And when I dug a little bit deeper into that data, we found that the majority of ours is attributed to the high housing costs, which I'm sure is not surprising to any of us. Healthcare, navigation, and literacy, how people reported receiving their information. We had 44.9% report getting that information from a doctor or a nurse, followed by 32% from the internet. We also found that we had some opportunities as far as what the residents felt like they needed or would like to see in health education initiatives. So holistic options to chronic disease, nutrition, and weight loss were some of the high-ranking suggestions for health education. So built environment, we were ranked number 3 out of 100 counties in North Carolina for our physical environment. Low access to grocery stores, we have 5% of people 65 and older, 6.1% of children, 2% of households with no car, 7.4% of low income. And one of the things that you will see in the book is we did want to highlight all the physical activities, opportunities that we have already built in with Dare County. So we have tons of county recreation facilities that are available to residents, as well as parks and beautiful beaches. So the economy, our median household income is around $55,000 a year. 29.6% reported owning a home, and that's compared to more than 55% in both North Carolina and the United States. The average rent in North Carolina the average rent in Dare County is $1,050 a month, and in North Carolina it's $816. So there's a little bit of a difference there. The average mortgage, which actually is a whole household cost, so it's not necessarily the mortgage, it could include escrow and electricity and things like that, $1,652, and compared to North Carolina, $1,243. Okay, so on to what we have decided to do based on this data, what the partnership has decided to address. We have had the Dementia and Alzheimer's Task Force since, I believe, the 2013 assessment. They have done some amazing work. They're led by Diane Denny. And so we have elected to continue that task force. They're doing a really great job. We also are going to continue our Breaking Through Task Force, which you guys heard a little bit about at, I believe, the October meeting. They're going to continue to work on addressing communication and stigma, as well as providing information for individuals that would like to see like to seek mental health or substance abuse treatment. We're also working on getting a transportation task force established. And we also currently right now have, instead of a task force, we wanted to come up with an access to healthcare work group because access is such a broad issue. And so we actually have Ronnie Sloan at Outer Banks Hospital who's leading that initiative. And right now they're doing lots of fact finding, trying to determine what opportunities we have to address. We also have the Adult Collaborative on Mental Health and Substance Abuse. And right now they worked on initially getting more information, doing more fact finding. And now they're going to be working directly with employers to educate them and educate their employees about mental health and substance abuse. So as far as what we're going to do amongst these task forces, the Breaking Through Task Force is going to work on their public awareness campaign that's going to focus on reducing the stigma. The Children and Youth Partnership, and again, this is an improvement plan that comes from everyone in the community, every group in the community that's a part of HCOB. So the Children and Youth Partnership is working with creating a mindful-based well-being program, and that will eventually be expanded into all of Dare County schools. The Saving Lives Task Force is working on creating a substance abuse action plan that's going to align with North Carolina's opioid action plan. And the Adult Mental Health Collaborative, as I mentioned earlier, they are working on assessing the services inventory as far as Dare County. It's probably really hard to read, but I wanted to just note, as Sheila mentioned earlier, this is not just myself. This is a huge group of people that come together to make this assessment possible. And the Outer Banks Hospital is a big partner in that. So I just wanted to make sure that I showed that. And then if you have any questions or you'd like to download the full report, you can visit darenc.com/HCOB, and you can download that right to your computer or device.
Thank you, Kelly. Any questions from the board? Kelly?
It's just, Mr. Chairman, I'm impressed she did that without taking a breath.
Yeah.
Great report. Well done. You're good.
Thank you. Thank you.
Some great data, and I had the privilege of seeing this initially last month, and great work on y'all's part, Kelly. It's some very good information for us to have.
Well, and thank you very much for having us. This is something I'm obviously very passionate about, but you all have been very supportive of HCOB and of public health, so thank you very much for
Thank
allowing
you.
us to come. Happy holidays.
I just had
Yeah.
a quick question,
Yes, sir, Commissioner.
Yes, sir.
and it's actually for both of you guys. Thank you so much for it. It's very informative, very good presentation. I cannot tell you how many meetings or occurrences where we discuss the substance abuse problem. And my question is a bit more on how do we go upstream on this? Do you guys, and again, I'm not looking for like, hey, here's the silver bullet or the solution, but any brief thoughts on how going upstream on it so that rather than treating the victim or the poor person that's, caught up in this, how do we get ahead of it? Any additional thoughts on that?
Well, Commissioner Ross, that's the million-dollar question, and we're fortunate in Dare County with the initiatives that we do have going on. I mean, Wally and the Saving Lives Task Force, but some of the newer initiatives that are being launched, Kelly mentioned the Children Youth Partnership and what they're looking to do in the schools. The work now in the school system with the ACEs, Adverse Childhood Experiences work. To go upstream, you really have to start down at the fundamental level with children and families before it hits this. And so
It's the
that's where a
adverse
lot of the initiatives
experiences.
are.
Sheila, every time I've seen it, it goes back to that adverse childhood experience and then the follow-on of what comes in the years after.
Right.
So I think, yeah.
So, and that work in Dare County is really just within the past year year and a half. So I think that's if we're looking at how we're eventually going to get upstream. But it's going to take all of it. It's that to hopefully make some change over time, but it's these other initiatives to kind of keep our community in support. I can't even imagine what our statistics would look like if we didn't have support in the community and the private providers and the collaboration with the Saving Lives Task Force. But it is, as you know, so multifaceted that without all of the different spokes that we have, I just can't even imagine what our community would look like. Absolutely.
I'd also like to add that I think some of this with the young people is stigma. So while young children might not have a stigma towards certain issues, their parents do. And so sometimes a child could be expressing concerns and the parent's scared that kid's going to be labeled. So I think that could be a piece of it as well, which we are working on addressing as well in Dare County.
Anyone else? Commissioner Couch?
Interesting that with your insight and expertise on what our kids up and teenage are faced with, I'm really grateful seeing the faith-based groups, and I know down in Hatteras, these church groups are bringing in a lot of kids and just trying to set them straight because there's so many people pulling on them. So it goes back to that circle of contribution that we have, not just with Human and Health Services, but all the people playing on the field. So thank you for your leadership role in all of this.
Thank you.